Some of Australia's most vulnerable Aboriginal children no longer have mental health specialists living and working in their communities. It's a move one child psychiatrist says sets the welfare and safety of children back at least a decade. Nearly 1,000 reports of child abuse have been made in the APY Lands region in the past 2 years alone. Mystery surrounds why the permanent mental health staff have left the remote lands. Patrick Martin has this exclusive report.
Child abuse is one of many problems facing the remote communities of the APY Lands that they want to address. Former Judge Ted Mulligan's 2008 inquiry brought the issue into sharp focus.
Over the course of his 10-month inquiry, retired Judge Ted Mulligan heard 141 children were abused.
People who are now abusers were abused themselves.
Speaking to the ABC from Pukaja community, Elder Makinti Minajuka says it's still a problem today.
Mum and dad drinking and drugs and all those things, leaving their kids behind, rejected. There's more and more children coming in from those problems.
In the 2 years to 2020, almost 1,000 allegations of child abuse were recorded by SA's Child Protection Department in the region. To address the problems for the past decade, 2 mental health workers have lived and worked on the lands.
If you have our workers living on the lands, plus local people being employed, then over and above whatever mental health benefits you're creating, you're also enhancing the community, which in turn feeds back on the quality of mental health.
Now they've been removed, leaving communities without on-country staff.
If you have any kind of idea of social justice and the social determinants of health, then you recognise straight away that that's a bankrupt system that's being implemented.
It's not clear if or when the mental health workers will return. Last month, SA Health Chief Executive Chris McGowan told the Public Service Union that his department had developed an interim model of care involving fly-in, fly-out workers and telehealth.
It's not going to work. The language barrier is hard. People have to come and work here, face to face, sit with the community.
The state opposition wants an explanation.
These services are grinding to a halt. They aren't being provided on the APY lands, and it's some of the most disadvantaged people in our state that are going to miss out.
Health Minister Stephen Wade says an integrated model of care is being developed, but won't say why the 2 workers aren't there.
I'm not in a position to comment on that. That's a matter for the Women's and Children's Health Network.
The network also declined to say why the workers are no longer based on the lands. Patrick Martin, ABC News.